I'm Dr. David Hill, and today we're going to be talking about how to give an infant liquid multivitamins. Now, the first question is, why would you give an infant liquid multivitamins? And the answer has largely to do with vitamin D. That's the one we really care about. Why do we care about vitamin D? Well, vitamin D has several important jobs in the body. Not only does it help the body process and utilize calcium to make strong bones and teeth, but we're now learning it also has a role in immune function, and that adequate vitamin D levels may even protect against diseases of the immune system in the future, like diabetes and multiple sclerosis. So we're finding it more important than ever to make sure that babies get adequate levels of vitamin D. Now, why don't they already have adequate levels of vitamin D? Well, vitamin D is not really found to a significant extent in breast milk. It is supplemented in formula, but not at such a high concentration that a child getting less than 32 ounces of formula a day is going to get adequate vitamin D. So to make sure your child does get adequate vitamin D in infancy, you're going to want to give some sort of multivitamin drop. There are some places, particularly Canada, where it's pretty easy to buy a straight up vitamin D supplement without any other ingredients. However, in the United States, the market is still responding somewhat slowly to the need for a single ingredient vitamin D supplement, so usually it's combined with a couple of other vitamins. One of the most common formulations of this is called Trivisol with A, D, and C. Then there's Polyvisol that's got a few more ingredients. You can also get the polyvitamins with fluoride if your child is greater than 6 months of age and does not have fluoride in his or her water, or also with iron if there's concern about iron deficiency anemia. Most doctors will check your child's hemoglobin level at 9 months of age to see if they do need to be worried about iron deficiency. So you got the drops, what are you going to do? The formulation is usually 1 dropperful, 1 milliliter every day, and you really do want to give it every day. Now, if you're using the straight vitamin D drops, there are a couple of different formulations, including one formulation where it just takes 1 drop a day. So you want to talk to the pharmacist, read the bottle carefully, and make sure that what you're giving is exactly the right dose for your infant. Now, people complain because a lot of the polyvitamin drops don't smell so good, they don't taste so great. There's not a lot to be done about that. The manufacturers have really done their best in making this stuff as good as they can make it. You might try different manufacturers' forms to find one that your baby likes the best. You may inquire about finding a pure vitamin D supplement if your baby doesn't like the polyvitamin supplements. And you may talk to your pharmacist about whether it's safe to mix the polyvitamin that you have with any sort of food or drink to make it more palatable to your baby. So talking about giving polyvitamin supplements to infants, I'm Dr. David Hill.